Michael Jordan is live, only on ABC's Good Morning America.
Protesters demanding their state reopen for business. Stay-at-home orders coming to a head in Michigan. At the same time, the battle against COVID-19 continues in their state and across the country. As that fight rages on, so many now asking how to revive the economy. New York's governor calls large-scale testing the single biggest tool. Today, some received the first batch of government stimulus checks. The president insisting the paper checks should have his name on them. But could that delay the process? Plus, the race to find a vaccine. What do we know about asymptomatic cases? More people already have antibodies than we even realize. And what do you do if you need non-COVID-19 care? We'll take a closer look. And we can't get enough of these pictures. Images of gratitude to our heroes on the front lines.
Good evening, everyone. I'm Lindsay Davis. Thanks so much for streaming with us. 46 days. That's how long it's been since the first reported coronavirus death in this country, a man in his 50s in Washington state. Since that time, countless lives have been saved. Senator Chuck Schumer may have said it best when he said sometimes heroes don't wear capes, some wear masks and scrubs. In these 46 days, we've seen some truly heroic work from those working on the front lines. But also in that month and a half since that first death, more than 27,000 Americans have passed away from the virus. Tonight, there are more than 619,000 cases here in the U.S. And in the same 46-day period, we've also tried to adjust with varying success to this new normal. Today, researchers at Harvard said without a vaccine, we should be prepared to keep social distancing intermittently until 2022. And in these 46 days, Americans have had to make some life-changing decisions, among them grappling with elderly loved ones in assisted living in nursing homes and their well-being. Our Tom Yamas leads us off.
Tonight, the relentless battle against the coronavirus. Even as New York flattens the curve, the death toll is rising. 752 people dying in just the past 24 hours. At Mount Sinai Beth Israel Hospital, Dr. Eric Eiting has been working the overnight shift.
We're seeing plenty of coronavirus cases, some people as young as in their 20s, and people as old as in their 80s.
This week, the hospital reversing its policies to allow some families time with their loved ones.
We decided to change it for patients where they're very near the end of life, so that people don't have to die alone.
And today, New York Governor Andrew Cuomo issuing an executive order requiring everyone to start wearing face coverings in public. In Massachusetts, the governor announcing deaths in the state now topping 1,000.
And I would say at this point in time that we are in the surge, yes.
And in Miami, a line of cars snaking around Hard Rock Stadium, hundreds showing up to be tested. But for many, the wait ending in disappointment. The facility can only perform 700 tests a day.
I came here yesterday. I couldn't do it, so I have to come back today.
And tonight, a growing consensus that stepped-up testing is the key to putting America back to work.
The more testing, the more open the economy. But there's not enough national capacity to do this. I'm telling you, we can't do it without federal support.
Today, the Wall Street Journal reporting that President Trump on a conference call was urged by executives on his recovery task force to dramatically increase testing capability in order to get the economy going. For the people waiting in unemployment lines in Florida and converging on food pantries in Phoenix, it can't come soon enough. Outside San Francisco, Nick Stanford, now unemployed, is pinching pennies at the grocery store.
We're barely scraping by, and we're getting behind. We're struggling. And
President Trump has yet to release federal guidance on how the country might reopen, and today facing backlash over his decision to strip funding from the World Health Organization.
The WHO failed in this basic duty and must be held accountable.
Today, an outcry in some circles, from the American Nurses Association, which called the move misguided, to Bill and Melinda Gates, who have donated millions to the fight against COVID-19 and sat down with David Muir for an exclusive interview.
I wanted to ask you, Bill, we've reported here in the last 24 hours the president revealing that he wants to halt all U.S. aid to the World Health Organization. Do you agree with that move?
Well, I'm hopeful that he doesn't follow through on that because we need their support. This is a global problem. They are the institution that brings nations together and make sure that, that we're sharing best practices between all of those countries. There'll be plenty of time to look back and see which countries did things well, which didn't, where should WHO have done things differently.
Have you tried to reach out to the president on this?
We did tweet our support for the WHO. We don't think they should have to start letting people go in the middle of the first modern pandemic.
WHO was created after World War II to deal with exactly these kinds of issues around the world. So halting funding right now, that just doesn't make any sense.
And Tom Llamas joins us now with more. Tom, we heard Governor Cuomo just a little while ago say that more testing is key to reopening the economy. What's being done to ramp up testing, and how much further do we still have to go?
Lindsay, that's the million-dollar question, and the short answer is the system really is not set up to do mass testing just yet. Governor Cuomo says there are 9 million people just in New York looking to get back to work, but every week they're only doing several thousand tests. We need millions of tests here in New York, and we need that at a wide scale all across the country. The president has said there's more than 300 million people across the country. It's just not feasible for everyone to be tested. Lindsay?
Tom Llamas for us again tonight. Thanks, Tom. And now our closer look at nursing homes, the epicenter of this current pandemic. Kaylee Hartung has a closer look.
These scenes strike fear in anyone with someone they love inside a nursing home. The National Guard suited up head to toe with protective gear, testing elderly residents at one Boston facility. The risk COVID-19 poses to the greatest generation clear since that first deadly outbreak in Washington state. For Deborah de Los Angeles, painfully obvious since she woke up to a voicemail on March 4th, delivering devastating news.
I couldn't believe it. I couldn't believe she was gone.
Her mother, Twyla June Morin, died that morning at Life Care Center in Kirkland, Washington.
Your mother was totally dependent on Life Care, and you feel like Life Care failed her.
Yeah, I do, and not just her.
At least 40 COVID-19 deaths are now linked to this one facility. We were there as the horror began to quickly unfold.
We've just seen another person loaded up into this ambulance to be taken to the hospital.
Susan Haley, a resident at Life Care, telling us what it feels like to be inside.
Do I want to leave? Yes, absolutely yes. It's not that the people aren't nice. It's that I don't like being trapped.
Families frustrated, begging for answers, feeling helpless as they wait for test kits to show up.
We have limited resources to battle this disease, and I think somebody somewhere decided that this population of people wasn't worth wasting resources on.
The fear and anguish we saw in Kirkland has now spread nationwide.
It's confusing. I will say that it's confusing, but I don't know what happened.
In Massachusetts, at least 36 veterans at the Holyoke Soldiers' Home have died with the virus. The situation's so alarming, federal authorities are investigating. 46% of the COVID deaths in that state are residents of adult care facilities. In New York State, as of Tuesday, at least 2,722 people have died in nursing homes and adult care facilities with COVID-19. There are positive cases in more than half the state's licensed homes.
Nursing homes have been an increasing issue because that is the vulnerable population in the vulnerable place.
And in Richmond, Virginia, now the deadliest single nursing home outbreak in the country. 45 people have died at the Canterbury Rehabilitation and Healthcare Center, and officials expect more people to die there.
To see a resident pass and to have nothing that you can do to prevent that from happening other than offering comfort and palliative care is traumatic. I mean, there's nothing but trauma when that happens. Every death, we die a little bit with every death that occurs in our facility.
Nationwide, ABC News has learned that more than 3,880 nursing home residents have died with COVID-19. And that number is based on just 13 states that are tracking nursing home deaths. Just yesterday, the CDC, FEMA, and the Centers for Medicare and Medicaid Services finalized a plan for nursing homes to report COVID-19 data to to the National Healthcare Safety Network. 6 weeks after her mother's death in Washington state, this news came as a shock to Deborah de Los Angeles.
They should have been talking about this in February, not April.
Deborah's now filed the first wrongful death suit in the COVID crisis against LifeCare. The complaint citing an investigation by the Centers for Medicare and Medicaid Services that concluded the facility failed to report an outbreak of respiratory illness to local authorities for 17 days and gave inadequate care to their residents during the outbreak. LifeCare, the largest privately owned long-term facility chain in the United States, is facing a fine of more than $600,000 from CMS.
LifeCare's a huge corporation and they should know better. They should just know better.
I know nothing can bring your mother back, but what do you hope this lawsuit brings?
Mostly to make nursing homes to do the right thing by their residents, do the right thing by their staff, because they're just as much, they might be younger and healthier, but they're still vulnerable.
And the staff at LifeCare telling ABC affiliate Como they did their best to try to manage an unimaginable situation.
Within 4 days, we lost 48 staff. We have about 170 staff. So within 4 days, you lose that many staff. It is next to impossible. In the next about 7 days, we lost another 32 staff.
We're all humans, so I think everyone is afraid, especially in the beginning when nobody's familiar truly with what's going on.
In a statement, LifeCare tells ABC News, our hearts go out to this family and the loss they have suffered during this unprecedented viral outbreak. We are unable to comment on specific legal cases that are pending, but we wish this and all families peace. The loss of any of our residents at LifeCare Center of Kirkland is felt deeply by us. Staff there continuing to care for the 32 residents who remain. But this nursing home in Riverside, California, was forced to evacuate its 84 patients.
The majority of the staff failed to show up for work, and indicating that they were fearful of their safety.
But now across America, the new reality. Families grappling with how to stay connected with those they love while also keeping them safe.
It's painful when you can't be with the one you love.
Judy Irish has been visiting her husband Bob at this nursing home in Wisconsin, but those visits look like this.
It has to be strict so no one gets it. There is no one in the nursing home with it at this point. And I feel it has to stay that way. So I guess we have to do what we have to do, but it's not easy. It's not easy at all.
Not easy, that is to be sure. And Kaylee Hartung joins us now. Kaylee, what a heartbreaking struggle for these families and a difficult challenge for the facilities that are trying to isolate while still remaining connected to the outside world.
That's right, Lindsay. And these facilities across the country are really locked down now. And one of the biggest challenges they're facing is the same broader challenge we're facing as a society. And that is the point of transmission is so often unclear. At LifeCare Center in Kirkland, they still don't know how the virus infiltrated its walls. I was tested positive for the virus. I don't know specifically how I contracted it. Now, I'm one of the 80% of people who were lucky enough to only experience mild symptoms with the virus, but for people in these nursing homes who already have weakened immune systems, who have underlying medical conditions, those are the people who this virus is ravaging. And they are already in these environments, Lindsay, where once that virus gets inside, it can spread like wildfire.
Right. All right, Kaylee Hartung, our thanks to you. And now to Washington, where President Trump is focused on efforts to restart the economy while pointing to progress in fighting the pandemic. Here he was in the Rose Garden just moments ago.
The battle continues, but the data suggests that nationwide we have passed the peak on new cases. These encouraging developments have put us in a very strong position to finalize guidelines for states on reopening the country, which we'll be announcing. We're going to be talking about that tomorrow.
ABC's Terry Moran joins us now live. And Terry, the president cited that progress, but there are still concerns about rising cases in some states and whether enough has been done to get widespread testing in place. So how is the White House addressing that as they prepare to release these guidelines to reopen?
Well, Lindsay, the White House is promising that testing protocol that is trying to be put in place around the country will ramp up. They're promising more tests, more robust testing program. But honestly, from the beginning, it has been plagued by problems and still falls far short of what most public health experts and many business leaders would tell you is necessary to have in place the testing programs and the tracing programs of the contacts of those who test positive in order to reopen the economy. President Trump is trying to cheerlead the economy back into life. The virus has something to say about that. When China tried to reopen its economy, workers wouldn't go back to work in China, where you get in trouble for that. And many business leaders, including some of the president's own counsel, say for reopening the economy, say first things first, let's get on top of the virus, let's support financially Americans and businesses who've been hit hard, and then slowly open the economy, watching the numbers in parts of the country as they rise or fall. We are a long way from home on this.
And today, the president also had a long aside about Democrats not confirming judges and other appointments that he's made. But these briefings are really meant to inform the country about the pandemic, right?
Well, they're called the White House coronavirus briefings, but there's no question the president has seen the ratings. Millions of people are watching, and he's not going to waste that opportunity in an election year. We've seen that campaign video, literally a video produced by his own political campaign, put in the White House informational briefings on the coronavirus pandemic. Might even be a violation of a Hatch Act to do that, an old law that is rarely enforced. But it's all Trump. It's the Trump show. It's what he is best at, he believes. It's his direct communication with the American people. A lot of people are turning in looking for information about the administration's policies and about what they should do in this pandemic, are getting a very strong dose of Trump promotion and Trump re-election campaign. It's his microphone. He can do what he wants.
All right,
Lindsay?
Terry Moran for us in Washington. Thanks, Terry. And joining us now is the governor of Oregon, Kate Brown. She is part of the team of West Coast governors collaborating on reopening. Thanks so much for joining us tonight, Governor.
Thank you so much for having me.
Your state really has seemed to flatten the curve. I mean, Oregon has had 58 deaths, and you've taken very proactive social distancing measures. Do you have any sense of a time frame that you're thinking about reopening, and what's the criteria for doing so?
Well, I took aggressive and early actions around social distancing, shuttering down parts of our economy, and Oregonians have made tremendous sacrifices to comply with these executive orders. And as a result, we've been able to slow the transmission and flatten the curve. We were able to send 140 ventilators to the state of New York. We are all in this together, and we need to support one another, and that includes as we reopen our parts of our economy.
Is any part of you concerned at all that the lack of deaths in the cases in your state will give people there a false sense of security?
Absolutely. I've laid out my framework for reopening the state. It includes a slowed growth rate in terms of new cases. It includes having adequate personal protective equipment. It includes adequate testing capacity. It includes the ability to do contact tracing, a robust public health system, and it includes the ability to isolate or quarantine those who are testing positive. So we're going to put more meat on these bones over the next couple of weeks with the help of Oregonians. It'll be a collaborative, collective effort. And this is a framework that we are working on in coordination with California and with Washington. It makes total and complete sense. We share borders. We have folks living in Oregon that are working in Washington and vice versa. So we are aligning our frameworks.
And since Oregon hasn't been as hard hit by the virus, and you mentioned just a moment ago that you generously sent along 140 ventilators to hard-hit New York, how is your ventilator supply at this point? And do you expect that New York will eventually send those ventilators back, or are you in a situation where you could send more ventilators to another hot zone?
Looking at the numbers right now, we have an adequate supply of ventilators. Most of them are in the care and custody of hospitals across the state of Oregon. I hope they will be generous because, as I mentioned, the sacrifices that Oregonians have made, we've done a really good job slowing the transmission and flattening the curve. But I think what's really important is that in this pandemic, each one of us can make a difference. And those 140 140 ventilators we sent to New York. It can save one person's life, somebody's grandmother, someone on the front lines of first responder, a child. Each one of us can make a difference during this pandemic, and we are truly all in this together.
And Governor, just curious, is there any aspect of all of this that keeps you up at night?
Yes, actually. While the fabric of our society is frayed right now, it's critically important that the foundation of our democracy remains strong. And I'm gravely concerned about what I've seen in other states, particularly Wisconsin this last week, where voters literally had to put their lives on the line in order to have their voice be heard, in order to vote. It's absolutely unacceptable when we have safe, secure, inexpensive methods like vote by mail. We've been doing it in Oregon for over 30 years. It makes sense to share this very wonderful practice. Oregonians love it because it makes voting convenient and accessible. You can do it from your kitchen table in your pajamas. Every voice should be heard, and every American should have the opportunity to vote. And expanding vote by mail or no excuse absentee should happen during this pandemic.
And so do you feel that there's enough time, we're talking about 6 months' time, that other states would be able to roll out a vote by mail entirely system?
Absolutely. Our Secretary of State here in Oregon, along with the Republican Secretary of State in Washington, are working with states to implement vote by mail. Most of the states have some form of absentee voting. This is just an expansion of that. The president gets to vote by mail. We should all be able to vote by mail. It's safe, it's secure, it will save lives, and it's even inexpensive. It totally makes sense. Why wouldn't we do it?
Tell us about the initiative that you rolled out just today with Stacey Abrams calling for $4 billion of federal money to go to states.
So it's critically important, given the pandemic, that Americans should not have to risk their lives or their health in order to vote. We think it makes sense for Congress to invest $4 billion to expand access to vote by mail, no excuse absentee, to make it easier for Americans to register to vote. Oregon was the lead on automatic voter registration. It's been extremely convenient. We now have 90% of Oregonians who are registered to vote. More importantly, we have folks who don't always have their voices be heard, registered in very high rates, including people of color, low-income folks, and folks living outside our urban areas. So this is really important to get these voices heard during this election cycle, and Congress has an opportunity to strengthen the foundation of our democracy, and they should take advantage of it.
But then we have the U.S. Postal Service, which is slated to run out of money by the end of September unless it receives a bailout. So are you concerned that that could become problematic then for an all-mail voting system?
I have to tell you, our postal workers have been incredibly important partners. I've been at the post office on election night. They literally scour every single corner of the office to make sure that every ballot gets in and make sure that every ballot gets counted. I am confident. We are seeing there are certain services, and I would put our postal service, that are absolutely crucial in times like these, and I am confident that Congress will make sure that our U.S. mail service will continue to run and will have the resources to do so. But they'd be a great partner for the entire nation to ensure that folks can vote conveniently and safely from their kitchen tables.
Governor Brown, great to talk to you tonight. Thank you so much.
Thank you. Have a good night.
You also. And another stunning number today shows just how much the coronavirus epidemic is impacting the economy. March retail sales fell nearly 9%. That's the largest drop ever on record. This comes as millions of Americans lose their jobs and many businesses remain closed. Online retailers, grocery stores, and pharmacies did see a spike in sales, but not enough to offset other dramatic losses. Consumer spending accounts for more than 2/3 of economic activity in the U.S. Meantime, in an unprecedented move, President Trump's name will appear on those $1,200 checks coming to millions of Americans as part of that more than $2 trillion stimulus bill. The Treasury Department denied that adding his name will delay checks from being mailed. But either way, experts believe this is the very first time a president's name will appear on a payment from the IRS. And we go now to a possible game changer in the fight against the coronavirus, the promise of a vaccine. A human vaccine trial is now underway in Washington state, while in Michigan, researchers are studying antibodies from recovered COVID-19 patients that may hold the answers. ABC's Matt Gutman has this report.
Tonight, injection by careful injection, the race is on to find a viable vaccine for COVID-19. In Washington state, the initial epicenter of the crisis, Neil Browning volunteered for the trial, only the second person in the country to receive the vaccine.
I feel like it's all of our jobs as human beings to step up and help out the rest of mankind.
The other race tonight, the search for antibodies. In Michigan, the nation's largest testing is underway. 38,000 Beaumont Health System employees asked to take part. Lab manager Tyler had a high fever back in February, but was it the coronavirus? He told our Diane Sawyer he tested positive for COVID antibodies.
What kind of relief did you feel when you heard this?
It's kind of like a little bit of a weight got lifted, just because there are so many people that are getting affected by this that it's just nice to know that I somehow got through it without too much issue.
But Tyler still waiting to find out if he is now immune to the virus, one of the keys to restarting the country.
Are you doing a preview of what it will be like to get a huge population back into their lives, back into the future?
You know, that's what we hope to do with this. You know, part of the goal of this is to figure out how to get people back to work, how to get people back to a relatively normal life.
We're joined now by Matt Gutman. And Matt, we're all hoping that those antibody studies give us important clues, but we still don't know if those who have had COVID-19 are now immune.
The presumption is that if you've had the virus, you are immune. That's how most viruses work. But scientists tell us they simply don't know how this particular virus works. They believe that you are immune to this particular strain. And what happens over time is that the level of antibodies in your blood decreases. And it's possible that you could get it twice because the level of antibodies has gone so low that it no longer registers in a test. Something happens that kick back up and there's sort of a muscle memory when a new virus or of the same strain is detected in your blood. We've also been hearing that people have gotten sick with the virus twice. We don't know if that's just an aberration or, again, if the antibodies went so low that the virus never actually left someone's system, and then for some reason it surged back up, making people sick with symptoms again.
And also, Matt, our gratitude certainly to those who are participating in the trials. Are they putting themselves at personal risk at all?
Yeah, absolutely. I mean, the first phase of these trials, Lindsay, is to check the efficacy and safety of these vaccines. So literally in this case, with the trials conducted in Seattle, these were human guinea pigs, the canaries in the coal mine. We did not test. The tests for the vaccines were not conducted on animals first. They were conducted on humans first. The good news is, so far, people like Neil Browning in the piece have had no side effects, discernible side effects. So it means it gives researchers a little bit of hope that at least they're on the right track. But don't expect this to expedite the release of a possible vaccine by any significant amount of time, maybe weeks or months. They have to make sure it's not just safe now, but it's safe a year down the road.
But they're on the right track. We'll take that optimistic news. Matt Gutman, thanks so much for your reporting.
Yep.
And when we come back, the harrowing moments. First responders pulled someone dangling from a bridge. They are on the front lines fighting COVID-19 while facing an uncertain future. We'll hear from some of the DACA recipients risking their lives fighting this virus and the struggles so many who need critical non-COVID related medical procedures are facing right now.
Right now, how do you make sense of it all? Now, afternoons on ABC, one place with the good information you need.
We are all in this together, and we're going to get through this together.
Pandemic, what you need to know. Afternoons at 1 Eastern, 12 Central and Pacific on ABC.
Your mom said, comb your hair. Your dad told you, smarten up. Your dog is judging you right now. And your best friend just called you crazy. We all need someone who'll pull no punches and give it to us straight. Now, imagine getting your news like that. No bull, no spin, just give it to me straight. Straightforward news, straight to the heart of the story. ABC News, straightforward.
It's the anticipated television event, The Last Dance. Now, tomorrow on GMA, Michael Jordan, a rare exclusive, one-on-one with Robin Roberts. Tomorrow, Michael Jordan is live, only on ABC's Good Morning America.
Welcome back. With hospitals across the country facing a crush of patients with COVID-19, both routine medical visits and surgeries that would have been urgent at any other time are now taking a back seat as many local and state health authorities put a halt to non-emergency procedures. And now some doctors fear that some of those delayed medical treatments could have their own devastating toll. ABC's Will Carr has this story.
Behind the doctors and the nurses on the front lines, another medical crisis is about to explode.
He did have several blood clots.
It's a ticking time bomb. You may end up seeing a lot more, people who may suffer. Either they may die, or they may end up having morbidity. They may end up getting issues which should have been addressed and handled right now, and we are pushing them.
So many hospital resources concentrating on the COVID-19 crisis, many local health departments have ordered a ban on non-essential surgeries, pushing serious medical procedures back, some indefinitely. You're concerned that more people could die by not getting the surgeries they need right now than from the coronavirus.
The longer we go now, no question about it. No question about this. In the San Francisco area, no question about this.
Medicines we give you, stop it.
Dr. Philip Theodosopoulos is treating Rosemary Pathy McKinney at UCSF in the Bay Area. Rosemary has 2 brain tumors.
It's just this constant head pressure, so it's always on my mind. It's just the fear of the unknown.
They were supposed to operate in March to remove one tumor and find out if both are cancerous. But the day before surgery, with her head shaved, because of that city order, Rosemary and her husband Rick were told they have to wait.
We're gonna cancel all the elective surgeries. And I said, well, she's having brain surgery. This is not elective. Nobody elects to have brain surgery, right? This is not a facelift.
In hospitals across the country, patients with critical life and death issues are being pushed to the top of the list for surgeries. Dr. Anu Shah in New Jersey worries about the other surgeries being delayed.
In that gray zone are urgent procedures which should be done within like 1 or 2 weeks, and those are not being done.
We usually do at Parnassus, which is our main hospital, we do about 70 operations a day. That's altogether all services. And we're down to about 8. 8.
In Washington State, Liz Rayburn suffers from tremors. She's undergoing deep brain stimulation, which requires 2 surgeries. In the middle of her first, while she was awake on the operating table, she says she found out the plan for the second changed.
My neurosurgeon, who's standing right behind me, said, Liz, I have some good news and I have some bad news. And I said, hit it. He said, the good news is that we're done and it has gone very well. The bad news is that your second surgery has just been indefinitely postponed.
Adding to the stress, patients like Rosemary, who's thankful to have had a successful brain surgery Monday, can't have their families with them before, during, or after their procedures.
I will hold her hand when she goes to sleep, and I will be there for her when she wakes up, and all of our folks. But that's tough. That's really tough.
Tough indeed. And Will Carr joins us now. Will, how are these patients that you spoke with coping with these delayed procedures? And how are the doctors and hospitals deciding who gets to the front of the line?
Well, Lindsay, it's a healthy balancing act. They're trying to weigh those critical surgeries that people need versus keeping all the facilities, the hospitals across the country safe. As for the patients we've been talking to, they're all taking it in stride. You heard from Liz with the trimmer. She has to have a couple devices installed during her surgeries, and she's keeping a healthy sense of humor. She told me that she's looking forward to being a functional cyborg, which really cracked me up. It also made her husband laugh, who was also her photographer because of our technical difficulties. surgeries. So she was definitely keeping a good sense of humor.
And as hospitals try to get through the immediate crisis, what are doctors saying some of the long-term consequences of these delayed surgeries could be?
One doctor tells me that right now they have a backlog of surgeries with their caseload of 6 months. He says that's right now. His biggest concern is what that backlog will turn into as this crisis continues to move forward. Another doctor tells me his biggest concern is economic. All the hospitals across the country plan in their budgets these surgeries, the money that comes from these surgeries. He's worried that on the back end of this crisis, the very men and women who are on the front lines right now could see pay cuts or even layoffs. Lindsay.
All right, Will Carr, thanks to you for that reporting. And when we come back, terrifying images, black smoke clouds lifting to the sky, ash and debris raining down, and now the investigation underway after this mill explosion. President Trump has been blasted for suspending funding to the World Health Organization in the middle of a global health crisis. How significant is the WHO? By the numbers. And our post of the day, rapper Meek Mill donating what he calls his dream car, the nearly $500,000 Rolls-Royce Phantom, to help those in need during this COVID-19 outbreak.
In times like these, the news-making events happen here. ABC News.
President Trump meeting face-to-face with one of the world's most brutal dictators, Kim Jong-un.
The president.
You trust him? I do trust him, yeah. I think he trusts me, and I trust him.
Ivanka Trump.
I have to ask you about your emails. Your father had taken Hillary Clinton to task for this.
There just is no equivalency.
So the idea of lock her up doesn't apply to you?
No.
Comey.
How strange is it for you to sit here and compare the president to a mob boss?
Very strange.
Michelle Obama.
What do you wish you could tell your pre-White House self?
Whew. Melania Trump.
Do you think there's still people there that he can't trust?
Yes.
Still working now?
Yes.
Michael Cohen.
So he's still lying?
Yes.
It's a big statement.
And now, in a year with so much on the line, we're right there.
Good evening tonight from Washington, a very busy news night.
America's #1 news source, ABC News, straightforward.
I'm a little bit anxious going into work. I don't really know what today will be like.
Everyone is COVID positive in these hallways. All you hear is oxygen. I'm seeing young patients, old patients, people of all age ranges who are just incredibly sick. In the critical care room is where we have our sickest patients. Just wanted to show you some of our equipment. So this is a ventilator machine. We keep it protected with plastic covering. I've never seen us have an empty spot in the critical care bay, but we try to make sure that we at least have space for one more emergency that comes through our door. Here comes the fun part, which is decontaminating my entire body. So I'm gonna pack up, get everything together, and think on my drive home, like I do every night, of what more I could be doing to help fight this crisis.
In the middle of this historic pandemic, President Trump has said that the U.S. will halt funding to the World Health Organization because of its early handling of the crisis, a move that's widely been criticized by public health experts, business leaders, and Democrats alike. So we're going to take a look at what the WHO does and how it's funded by the numbers. The WHO has more than 7,000 workers operating in 150 offices around the world to combat diseases. The U.S. funds about 20% of the WHO budget. That's about $400 to $500 million per year, making it the organization's largest donor. The WHO's second largest donor, the Bill and Melinda Gates Foundation, pledged $581 million for 2 years. Now, some say the WHO is already underfunded. $4.8 billion is the organization's 2-year budget for 2020 and 2021. That's about the budget of a large U.S. hospital and much less than the CDC budget. Since its founding in 1948, the WHO has helped combat threats from smallpox, polio, malaria, HIV, AIDS, H1N1, MERS, Zika, Ebola, and now COVID-19, just to name a few. We have a lot more to get to on ABC News Prime. They don't have U.S. citizenship, but tonight they are on the front lines saving lives. Meet the DACA doctors. Also, the April snow causing a massive pileup in the Midwest. But first, here's a look at our top trending headlines on abcnews.com.
We know
know coronavirus has affected so many of you.
America has changed for now. There's no question about that.
People are finding a way to come together.
What else should people know about how to care for their families through this?
And you feel it's not too late to flatten the curve.
It's not too late.
When do we expect to have a vaccine?
George, we are all thinking of you, Allie, and the kids, my friend.
She wanted to share this message.
You know I'm feverish if I'm allowing myself to go on national television with no makeup on.
Allie is now on the Roberts family prayer chain. Robin, how you doing? I'm loving this. Gonna keep these slippers on.
We are so grateful that we get to do this from home.
I'm gonna take the camera and turn it around. Kelly was doing prompter. You do know you're sideways, right?
It's great to see so many Americans stepping up.
All in this together.
The world coming together as one.
We're going to get through this together.
Right here with you on Good Morning America.
This is what being live is all about. This is ABC News Live, the 24/7 streaming news source from ABC News. Breaking news, live events, streaming nonstop. Original breakthrough storytelling from ABC News, National Geographic, ESPN, and it's all designed differently for you to stream straight to any screen whenever you want.
ABC News Live.
Streaming everywhere, right to you. ABC News Live. It's that easy to go there.
The Americans here on the ground and the Iraqis. 18,000 tons. Patatas. Ismail? David.
Over ground zero from Hurricane Michael.
You can see just home after home.
David, nice to meet you.
This was your view.
My favorite view.
Thank you very much.
Thank you.
The coronavirus outbreak in the United States is beginning to show signs of leveling off, especially in hard-hit states like New York.
You see flattening of the curve, all these new expressions that we never used before. Plateau, flattening, rounding. ICU admissions is down, that's good news. Intubations are down, that's very good news.
Governor Andrew Cuomo says the number of deaths is still not going down quick enough. 752 people died Tuesday statewide.
It's over when people know I'm 100% safe and I don't have to worry about this. When does that happen? When we have a vaccine.
And around the country, stimulus dollars are hitting bank accounts. The money started showing up within the last couple of days, with all the first-round payments expected by today.
I've been waiting for it. It's going to help me out financially, be able to pay some bills, get ahead of the schedule a little bit.
When it comes, I count it as an extra blessing.
The first payments are going to those who filed their 2018 or 2019 tax returns and authorized the IRS to make a direct deposit. Of that group, those with the lowest incomes should receive their payments first.
Europe slowly trying to return to normal. Spain easing some restrictions as they see a decline in new coronavirus cases for the third day in a row. Workers get back to their daily routines, even getting coffee. Despite serious concerns, nearly 300,000 workers are now clocking back in, an attempt to revive the country's stalled economy.
It's scary, you know? I wish we would wait a couple more weeks.
In Italy and Austria, smaller shops like booksellers and children's clothing stores are back in business.
It cannot happen all at once. Control measures can only be lifted if the right public health measures are in place.
It's been a year since a devastating fire gutted the famous Notre Dame Cathedral in Paris. Restoration has been halted because of the coronavirus.
Nos journées, nos pensées.
Our days, our thoughts, our lives today are monopolized by the terrible crisis we are going through. But exactly 1 year after the dramatic fire which has ravaged part of the Notre Dame de Paris Cathedral, I wanted again to thank all who yesterday saved it and all those who today are rebuilding it. We don't forget anything.
A late snowstorm in the Chicagoland region this morning caused a massive pileup on a city expressway. More than 50 cars were involved in this crash, requiring at least a dozen tow trucks to remove an absolutely mess of inoperable vehicles. 14 people were transported to local hospitals. Thankfully, none of their injuries were critical, according to Chicago Fire. 45 others were evacuated on the scene. More snow is in the forecast for the region on Friday. And we're getting a new look at a dramatic rescue of the driver of a tractor trailer stuck dangling 70 feet over the Elizabeth River in Chesapeake, Virginia. The extreme wind gusts that toppled the truck also sprayed a mix of water and diesel fuel at them as the firefighter worked to tether the drivers to the harness. After a nail-biting hour-and-a-half operation, the pair was finally lifted to safety. The driver said the firefighter kept him calm with words of encouragement, and that made all the difference. The driver was taken to the hospital and later released with only minor injuries. And take a look at this video of an explosion at a paper mill in Maine today. It happened late this morning at a mill in the small town of Jay. The paper mill company says everyone on site is accounted for, and thankfully no one was hurt. It's not clear just what led to the blast, and the company says it is assessing whether air quality in the area may be affected. As we've been reporting, it's all hands on deck at hospitals and clinics across the country these days. But as governors call for reinforcements, thousands of healthcare workers in the U.S. under the DACA program face the possibility of losing their jobs and even getting deported if a critical Supreme Court decision doesn't go their way in the coming weeks. Here's ABC's Devin Dwyer.
I've been working since 6:30 this morning. It is right now 12:30 at night.
For Florida paramedic Aldo Martinez, long days and high stress are the new normal.
It's been about 18 hours of call after call. You can even see it on my cheeks, the redness from the mask, the N95 masks that we have to wear.
Martinez is one of an estimated nearly 30,000 immigrant physicians, nurses, technicians, and aides who have U.S. work permits through DACA, the program started by President Obama that grants temporary legal status to undocumented immigrants who came to the U.S. as children. Martinez was born in Mexico.
If somebody from your family was having a heart attack or a stroke or had just had an accident, and now we have 27,000 people less to respond to those kinds of emergencies. Just something to think about.
Those immigrant workers on the front line now facing an uncertain future after President Trump canceled DACA in 2017, threatening to end work permits and worse for the more than 650,000 who enrolled in the program.
Every day I wake up with the uncertainty, not knowing if DACA will end or if I may be deported, and that's a hard reality to face.
Denise Rojas is a medical student at Mount Sinai, now helping COVID patients in New York City.
What I do know is at this very moment, I can be of help in this crisis, and that's what I intend to keep on doing.
In Rhode Island, that passion driving DACA recipient Gracia Rivera, a third-year med student at Brown.
I've been helping at my local Department of Health to help call patients who test positive and call their close contacts to make sure that they're doing well.
And in California, there's Dr. Nuleta Vongskorn, the first undocumented immigrant to graduate from the University of California, San Francisco Medical School.
It is just yet another example of how immigrants, particularly undocumented immigrants, certainly DACA recipients, continue to show up and do what we can to be a part of this country.
The fate of DACA and those essential health workers that rely on it rests here at the Supreme Court. It's closed during the pandemic, but the justices expected to hand down a decision any day.
If the Supreme Court upholds the decision to cancel DACA and my DACA ends in August 2020, I will be left with the question of whether or not I will complete my residency training.
Dr. Nuleta Vongskorn and other DACA recipients have written the justices to factor the pandemic into their imminent decision and throw a lifeline to immigrants on the front line.
These are people who are actually on the front lines. There are some 200 of them that are practicing doctors. There are statistics that show that every doctor treats around 5,000 patients per year. Multiply that by 200, and in a pandemic like this, doctors are treating a lot more.
The Departments of Justice and Homeland Security both declined comment to ABC News on the role of DACA recipients responding to COVID-19 and whether they've studied the impact ending DACA would have on the U.S. health system.
Every single one of these professionals right now is precious to our systems. It is absolutely not appropriate to say that these people should put their lives on the line for the rest of the country, only to have their fate hanging in the balance.
The president says DACA is unconstitutional. Congress could enact a solution, but has repeatedly failed to do so. That leaves the Supreme Court in the tricky spot of deciding what's next.
They need to understand that we are essential, that we are productive, and we provide for this country, for the people that they love, for the people that we love.
A plea for empathy and understanding.
If the Supreme Court decides to eliminate the program and Congress doesn't act to pass the legislation for us, it would put my career as a physician at a stall.
So much on the line while the fight against COVID-19 goes on.
I continue to chug along with my community and just hope for the best, because sometimes that's all you have is hope.
For ABC News Live, I'm Devin Dwyer in Washington.
Really important storyline there. Our thanks to Devin. And when we come back, American ingenuity at its finest. Some of the creative ways people are passing the time or making a difference.
Right now, how do you make sense of it all? Now, afternoons on ABC, one place with the good information you need.
We are all in this together, and we're going to get through this together.
Pandemic, what you need to know. Afternoons at 1 Eastern, 12 Central and Pacific on ABC.
The world may feel out of your control, but your happiness doesn't have to be. Learn the secrets to happiness. Listen to the 10% Happier podcast, free on Apple Podcasts.
This is what being live is all about. This is ABC News Live, the 24/7 streaming news source from ABC News. Breaking news, live events, streaming nonstop. Original breakthrough storytelling from ABC News, National Geographic, ESPN, and it's all designed differently for you to stream straight to any screen whenever you want.
ABC News Live.
Streaming everywhere, right to you. ABC News Live. It's that easy to go there.
In one place, the vital information helping you protect yourself and your family. ABC News. Outbreak. Your questions answered here.
Good morning, sunshine.
Good morning. Good morning. Oh, I'm grateful you woke up this morning.
Good morning, sunshine.
Good morning, sunshine. We've been waiting for you. Say good morning. Good morning, sunshine. In America. Say good morning. I want you to wake me up.
The coronavirus. Everyone has concerns. And tomorrow, Dr. Jennifer Ashton is here, helping you better understand it all. Tomorrow.
On Good Morning America.
It's the anticipated television event, The Last Dance. Now, tomorrow on GMA, Michael Jordan, a rare exclusive, one-on-one with Robin Roberts. Tomorrow, Michael Jordan is live, only on ABC's Good Morning America.
Houston, we've had a problem. My immediate feeling was just a sick feeling in the pit of my stomach, a disappointment. I knew we had lost the landing.
And from then on, it was not a third landing on the moon, but a survival of how to get home.
So it was a question of getting this entire world geared and oriented to one single job, get the crew home.
Teamwork was necessary. Good leadership, initiative to think outside of the box when things go wrong, how do we repair them? Those are the three things that were absolutely necessary.
Teamwork, leadership, and thinking outside of the box, all just as important now as it was 50 years ago this week when the astronauts aboard Apollo 13 splashed down back here on Earth in what has become known as a successful failure. During this global crisis, we've all had to improvise a bit, and for some, this new normal is anything but ordinary. But still, some are using these dark days to create some bright bulb ideas, in some cases capable of illuminating the world. It's been said necessity is the mother of invention. So perhaps quarantine is the father of creativity. And this father of two girls in the United Kingdom refused to let the coronavirus stop his girls from skiing. So many physically stuck at home while their imaginations run wild, concocting quarantine creations to ward off boredom. And how about this example of if you build it, they will come? Starbucks, anyone?
She already knows, like Starbucks, she gets her cake pop.
Socializing while maintaining distance. We are a creative bunch. Travel plans canceled? How about a new spin on a staycation? Virtual reality is 2020's ultimate getaway. While I'm running in my basement, my mind is in Hawaii. With all this time at home, some pets are actually fed up. But harnessing the creativity needed to come up with dog wine deliveries may not only maintain our sanity, it could just be helpful.
This is the best thing ever.
At the University of Wisconsin-Madison, robots on wheels zip around campus, delivering food to students to minimize interaction. Here in New York, a team of volunteers known as Invisible Hands run errands for those who must stay indoors.
Hi, ma'am. So I put your prescription there. Of course, no worries. It's been a communal experience for all of us facing this crisis.
Creativity is also leading to some interesting choices, all in the name of trying to stay safe.
Going in.
The shortage of masks is a real threat, a challenge fashion designer Christian Siriano realized he could tackle head-on, enlisting his team to manufacture thousands of cloth masks.
We make clothes every day, well, we can make masks every day. So it was really a simple thing.
Now Louis Vuitton is among the many designers stepping up to help. With those critical N95 masks running low, especially in Florida, Dr. Bruce Spies realized he could help some healthcare workers with material that's found in every hospital.
We're throwing away all this wonderful material that's right in front of our eyes.
With that blue fabric typically used to wrap sterilized equipment, a team of volunteers is creating thousands of masks.
I trained as a physician to help my fellow mankind.
But how do healthcare workers coming home to their families keep their loved ones safe?
For a minute, I was thinking, I felt scared I'm by myself. And then I'm like, I'm not by myself. My husband's right in the driveway. So he's protecting the house.
Emily Phillips is married to a doctor. She wanted to keep him close without endangering her family's health. So she posted a question on Facebook. Could anyone spare an RV?
I was really, really starting to worry about my family because of what Jason could be bringing in, my husband.
Holly Haggard answered the call.
We had my mom's camper in the shop, and I did consult with her as well, and she said, yeah, let them use it for as long as they need, and no, we're not going to charge anything, just tell them to pay it forward.
The group RVs for MDs was born.
We have volunteers nationwide, and I say nationwide, it's all throughout the U.S., but we've also got some in Canada and in Australia. We have a guy in Dubai.
3 weeks since that fateful encounter, more than 650 matches have been made.
It's impacted them just as much as it's impacted the person getting the RV. They once felt powerless, and now they have a purpose.
I think it's amazing. It's really seeing the outpouring of things like that.
Hi, Daddy.
Hi, guys.
Hi, Jason. We miss you.
Keeping those we care about close, even if it's not exactly how we envisioned. Whether it's a salvage prom night, a virtual graduation, giving your best friend a birthday gift, making happy hour happen, even asking someone out on a date.
You look beautiful!
When faced with a challenge, imagination kicks in, even if it doesn't manifest in ways like 3D printing PPE for doctors and nurses. Many of us are engaging the left side of our brain a bit more these days. Sometimes it's as simple as changing the background on the next conference call. Creative minds and generous hearts. And one of the most impactful moments in all of sports history happened on this very day back in 1947. That was when Jackie Robinson first started for the Brooklyn Dodgers, effectively breaking baseball's color barrier. 5 days after his landmark signing with the team, Robinson bravely stepped onto Ebbets Field in front of 26,000 people in a simple act of dignity and defiance. Robinson did face death threats, but through his grit and determination, not to mention his incredible playing, he won over the nation as he opened the door for generations of athletes to come. Had the Major League season been underway today, all players on every team would be wearing Robinson's number 42 in his honor, but for today only, because his number has since been retired across every Major League team, no one will ever wear it again. In the words of Robinson himself, a life is not important except in the impact it has on other lives. And what a tremendous impact indeed. Here's to you, Mr. Robinson. And before we go tonight, our image of the day, married Tampa, Florida nurses Mindy Brock and Ben Crayer wearing protective gear. They take a moment to connect. Crayer says this photo is, quote, a symbol of hope and a symbol of love. We think so, too. And that is our show for this hour. Be sure to stay tuned to ABC News Live for more context and analysis of the day's top stories. I'm Lindsay Davis. Thanks so much for streaming with us, and have a good night.